Hello, my name is Jessica Caramaya, and in this presentation I will speak about the community analysis of downtown Clearwater. The objective of this presentation will be discussed in the following order: a brief historical overview of downtown Clearwater, the community analysis of the community through structure, the population, health-related resources and availability, Healthy People 2020, environment, government, and public resources, and finally, the prioritized community needs. The Pinellas County area was first believed to be discovered by the Spanish explorer Pánfilo de Narváez in 1528 when he landed in the downtown Clearwater area. Clearwater was originally known as Clearwater Harbor, and the first settlers arrived in the area known today as downtown Clearwater in 1822, when Florida became a Spanish territory. The Seminole Indian Wars of 1835 led to the construction of Fort Harrison, memorialized today by the Fort Harrison Avenue. During this time, the town lived heavily off the land and animals for food, such as fish, deer, turkey, and crops like corn and sweet potatoes. The downtown Clearwater area continued to expand through the 1800s into the 1900s due to its climate, real estate, and after World War II, after soldiers were drawn to the area after having trained in the Clearwater Harbor. Today, downtown Clearwater has an average of 253,963 citizens within a 5-mile radius and sees over 1.8 million visitors each year. These visitors are either visiting the location due to its historical landmarks and buildings that still stand today, to visit the Clearwater Harbor to fish and exercise, have a night out to one of the many restaurants located in the area, or just passing through to reach Clearwater Beach. The structure of downtown Clearwater is continuously evolving due to its tourist population, snowbirds, and people moving to the Clearwater area. Housing varies depending on the needs of the community. Within downtown Clearwater, there are various housing options such as condos, apartments, long-term and short-term facilities, and permanent housing. Affordable housing is also available for individuals and families that can be provided through Volunteers of America and Habitat for Humanity, both of which are based within the downtown Clearwater area. One issue identified during the community assessment analysis was that there was no housing available for the homeless population within the downtown area. Located within the community, there is only one private school known as St. Cecilia Interparochial Catholic School, which educates children pre-K through 8th grade. This school has monthly fees and can pose issues for low-income families who cannot afford this school for their children. However, there are public schools just outside the downtown area and are within walking distance from downtown. The Ultimate Medical Academy is a nonprofit healthcare technical school also located in the downtown area, which provides affordable tuition and scholarships for students of the community. Located within downtown Clearwater is also Clearwater Main Library that overlooks the Clearwater Harbor and has various resources for the community such as tax help, information on housing, technology services, children's programs, job assistance, and much more. Downtown Clearwater has no main community assistance facilities based within its boundaries. However, the RCS Food Bank, which offers services to residents of Clearwater and Pinellas County, and the Clearwater Health Department are also located just outside the downtown area. During the community assessment assignment and the windshield survey, one population issue that was identified from the data collected was the homeless population situation. In 2018, there was an identified total of 2,612 individuals that were homeless either for a short period of time or chronically throughout Pinellas County. Within downtown Clearwater and the entirety of the city, 21.5% of these individuals stayed within Clearwater. A survey conducted by the Department of Housing and Urban Development also identified that financial reasoning was the cause for 41.9% of these individuals being homeless. This is even more concerning as 15.9% of the community lives below poverty level. The top health concerns for the community include sexually transmitted diseases, cardiovascular disease, and cancer. Chlamydia and gonorrhea are the top communicable diseases for downtown Clearwater. Nationally, there are over 1 million new cases for chlamydia and over 400,000 new cases for gonorrhea. This indicates a better education of safe sex practices and resources should be available for the community in order to prevent continued transmission of these diseases. Cardiovascular disease and cancer are also prevalent in the downtown area. This may be due to the high increase of individuals over the age of 65, the year-round sun exposure, which can cause skin cancer, not wearing proper protection such as sunscreen, glasses and hat, and smoking, which can lead to lung cancer. In 2016, Florida ranked 38th and 40th in heart disease and cancer, respectively, for the top two leading causes of death, according to the CDC. Although there is no hospital located within the downtown area, Morton Plain Hospital is right outside the outskirts of downtown Clearwater. This hospital cares for roughly 50,000 patients annually. Clearwater Free Clinic, based within downtown, and the Clearwater Health Department just outside of downtown, both offer affordable health care that is based off one's income and can even be free to certain individuals. The Clearwater Free Clinic is only available to permanent residents of Upper Pinellas County. While there is no urgent care facility within downtown, Bayside Urgent Care Center is just outside of downtown Clearwater and takes in walk-ins and accepts all forms of payment and insurances. There are several long-term and acute care facilities in the downtown area for elderly residents. Costs vary depending on needs of the individual, and they accept many forms of insurances. The following Healthy People 2020 objectives were chosen for downtown Clearwater: access to health services, cancer, and heart disease and stroke. Access to health services was chosen due to previously identified research on low poverty levels within the city and the increased homeless population. Due to these populations having little to no financial income, it is important to identify them and provide accessible health services, as this can prevent preventable hospitalizations and disease, and unnecessary financial burdens related to hospitalizations that can be detrimental to these individuals. Cancer and heart disease were chosen as they were identified as the top two leading causes of death in the community. Modifiable risk factors such as sun protection, cessation of smoking, alcohol consumption, sedentary lifestyles, and unhealthy eating can all be managed through education resources available within the community at little to no cost. Downtown Clearwater offers a variety of parks and recreational activities accessible to all its residents and visitors through various parks, fishing, courts for playing tennis, trails for running, biking, and skating for free cost with locations throughout the area, which is a valuable resource for those of low income who may not be able to afford gym memberships. All these locations are all well maintained, lighted, and monitored by security and law enforcement for safety of its residents. Due to the influx of population throughout the year, downtown Clearwater has the Clearwater Police Department and Clearwater Fire and Rescue based within the community, as well as throughout the city itself for added protection of the population and quicker response times of 4.5 minutes. Each department offers a variety of volunteer services, education programs, and CPR classes for its residents. Clearwater Beach has again been chosen as the #1 beach by USA Today. Due to this, downtown Clearwater sees 1.8 million visitors each year. As a result, depending on the time, there are high concentrations of traffic through the day and especially during the weekends, holidays, and summer. This is concerning for pedestrians as car drivers can become easily distracted while waiting to get to the beach, or may be intoxicated or tired returning from the beach. The City of Clearwater attempts to counter these situations by implementing several crossing sections with flashing lights to alert drivers when a pedestrian is about to cross, and cameras at busy intersections. The City of Clearwater is governed and made up of 5 council members. The mayor is regarded as seat 1, and so on. Community members are able to speak with council members via email or during community meetings. Public meetings are held every first and third Thursday of the month with moderate community attending, and can be publicly attended, viewed online or on TV on Spectrum Channel 638, WOW Channel 15, and Frontier Channel 30. Budget allocations for the year 2019 are for police, fire, engineering, library, city administration, non-departmental, planning and development, parks and recreation, and other. Other federal funding will primarily be used for housing, community, and economical development activities for the City of Clearwater. No areas of concern were identified for economic, political, or public policy. This may be due to council members having equal power in voting and community members being able to speak during meetings on areas of concern, which council members take into consideration when voting or making public policies. The prioritized community needs are listed from 1 to 6 based off of Maslow's hierarchy of needs. 1. Homeless shelters was listed due to the visible homeless population seen on a daily basis in Clearwater, downtown area. During extreme weather changes, especially during hot summer days, the closest emergency homeless shelter is located 6 miles inland in Safety Harbor. This concern needs to be addressed as it can be dangerous and life-threatening to individuals who cannot meet the basic physiological needs on a daily basis. 2. Pedestrian crossings is listed based on safety needs, which can cause immediate danger to civilians who are on foot or bicycling by busy intersections and high traffic times in the downtown area. Alcohol abuse is listed as it can directly and immediately affect the safety needs of the individual and others they may come in contact with. This is a community need as the town is a tourist attraction where the substance is readily available through bars. Access to health services is listed due to 15.9% of the population under the poverty line. This is critical to the community as they may delay care for preventable and treatable diseases and can lead to further financial burden and disease. Cancer and cardiovascular disease are listed as they were earlier identified as being the leading cause of death within the community and state. Being in the Sunshine State, it is important to use caution when out in the sun. During the windshield survey, many citizens and tourists were out in shorts and tank tops, and without the proper precautions, this can lead to cancer in some individuals. Tobacco use and promotion through shops was also heavily seen during the survey. This is a known modifiable risk factor of cardiovascular disease and some cancers.